Hello, ladies and gentlemen. Welcome to HAS 20 Virtual Summit Breakouts. During this session, you'll be able to submit questions and upvote questions from other attendees. The questions with the most votes will most likely be among the questions asked by the host to the presenter at the end of the session during the live Q&A. The bottom right tile box is where you can type in your question as well as click the thumbs up button to upvote a question. During the session on the top right tile box, you will also see a 5-question quiz based on the speaker's content. Enhance your learning by taking the quiz during the session and get points for your correct answers. All sessions will be available on demand, and if the presenter has given us permission, you will also be able to download the slides. It is now my pleasure to introduce Session 5, Opening the Door for Patient Access, Growing Monthly Visit Volume by 27%. It will be presented by Carrie Riss, Assistant Vice President, Ambulatory Operations, Texas Children's Hospital, and Grace Karen, Assistant Director, Business Operations and Strategic Planning, Texas Children's Hospital. Enjoy the session.
Hello, my name is Carrie Riss, and today we're going to be sharing with you an exciting journey that Texas Children's has been on to improve patient access. Grace and I will be talking to you about many of the improvement initiatives that we have been able to achieve here at our organization. So today on our agenda, it will include reviewing the learning objectives as well as sharing the patient access journey at our organization. We'll also examine the necessary course correction in the face of COVID-19 that our organization, as well as many of yours, are facing today. And we'll also communicate to you some of the great results we've been able to achieve over the course of time. So our learning objectives will include describing a structure and strategy for organizations to implement a scalable patient access initiative. We will also discuss the value of collaborative administration and physician lead improvement efforts to really drive change. In addition, we'll also review a process for quickly adapting to critical healthcare services for patients during the early stages of the COVID-19 pandemic. So a little bit about our organization. Many of you may have heard about Texas Children's Hospital, but we are a very large standalone pediatric hospital. We opened our doors back in 1954, and today we're licensed for over 950 beds. We do have one academic partner, that is Baylor College of Medicine, and we have over 2,000 faculty, residents, and fellows helping support our great organization. As you can see here, we have many statistics just to provide the size and scope of Texas Children's today. So why the urgency around patient access at Texas Children's? We are world-renowned for providing exceptional pediatric care, and as a result of that, we often had more demand than we could meet. And as a result of that, we often heard from families as well as referring providers that we were simply difficult to access. We heard that appointments were not available for patients, they couldn't reach a live person to actually schedule the appointment, and the wait times were simply too long. In addition, from our referring providers, we often heard that they couldn't keep up with each clinic's preference. All of our clinics had a different way at which they wanted to accept a referral, and it made it very difficult for referring providers. In addition, we had inconsistent follow-up with patients regarding those referrals that were being sent to us. And so with all of this feedback, we knew that we needed to take action to do something different at our organization, and that prompted us initiating our Patient Access Improvement Initiative. So we began to collect information and survey patients and families around how this could be better and what their expectations really were. We knew from collecting the survey information that patients really expected to be seen within about 2 weeks. They really didn't want to wait beyond 2 weeks to be seen. In addition, they were willing to drive over 50 minutes to be seen. And Houston is a large metropolitan area, so we do have clinics across the city, and that was important. In addition, it was important that 94% of patients and families really see the physician that they actually wanted to see. We also learned that over 50% of patients and families did want to schedule their appointments online. And when we started this initiative, we did not offer online scheduling at our organization. We also knew that 72% of patients and families really preferred to communicate via text and email as their primary contact method. And we also knew that over 63% of patients and families really prefer to get a financial estimate prior to coming in for services. So these were the expectations and preferences of the families we surveyed. We also collected our own baseline data regarding what opportunity existed. So while we had significant amounts of patient demand and long wait lists, in 2017, 20% of our appointment slots went unfilled and unused. In addition, we had an 11.5% no-show rate across the system, and that no-show rate represented thousands of appointments that were not realized by patients needing them. In addition, when we started the project, only 66% of our specialties could get a patient in within 2 weeks. We also knew that only 51% of our patients did actually use our patient portal. And so as we thought about technology like online scheduling, e-check-in, things to really enhance some of the needs of our patients, we really needed more of them using our patient portal. In addition, we do collect satisfaction survey data, as many of our other organizations do, and we knew that only 57% of families said that they had a very good experience with the ease of scheduling. So we definitely had opportunity there. And we also identified, sadly, that we had over 60 different referral processes, again, across Texas Children's Hospital, making it very difficult for those referring providers to send patients to us. So as we launched our annual access cycle, we did begin a journey that went over the course of 3 years. And it did start in 2017 and fiscal year 18. And this was really what our access cycle looked like. In August, we would identify task force and work group members from across the system to help us achieve improvements to access. In addition, for the months September through November, we would conduct an assessment that said, this is how we think access could be better at Texas Children's. In December, we would actually propose and seek endorsement from high-level senior leaders regarding recommendations for improving access at our organization. In addition, in January through February, we would begin to plan our implementation for improving access. And then from March through September, we would actually begin going live with those implementations. This timeline does align to our fiscal year, and it's important to note that we have had a system-wide goal around access improvement for all team members for the last 3 years, which really helped us drive these changes. Access 1.0, which was fiscal year 18, really focused on initiating the project as well as improving access, so a lot of the low-hanging fruit we needed to think about, as well as driving change. After coming out of Access 1.0, we made a lot of improvements, and so we did continue the project into Access 2.0 for fiscal year 19, and that was really focused on keeping the momentum, widely deploying online scheduling, as well as really enhancing appointment reminders to ensure that we were reducing that no-show rate. And then Access 3.0 was really for this fiscal year around hardwiring, optimization, and customer obsession. But as we'll get to in a little bit, our access focus really changed in the face of COVID-19. So here we have our access and patient scheduling initiative structure, and this was a very robust structure that included over 200 team members from across the organization coming together in a unified goal of enhancing access at Texas Children's. Our executive steering team included senior vice presidents, executive co-chairs, physician leaders, ambulatory executives, IS executives, and project management. The executive co-chairs for this team included myself as an assistant vice president of ambulatory, as well as Rochelle Fleischer, who is our senior vice president of the revenue cycle, as well as Dr. Larry Ollier, who is our surgeon in chief. In addition, we had teams working on referral improvement, patient scheduling experience, increased capacity and improved utilization, as well as financial optimization. And across all of these areas of improvement, we also had sustainability efforts. At many organizations, you will improve and create these amazing new processes, but if you don't have models to sustain those improvements, they oftentimes go to the wayside and are not sustained. So it was critical for us to drive through these improvements for the long term with sustainability, data analytics, marketing and communications, as well as change management. So this was our collective team that came together to drive some of the change we're going to talk to you about. Our access areas of focus for access included increased capacity and improved utilization, patient referral optimization, as well as patient portal and scheduling experience. So now I'm going to hand it over to Grace, who's going to talk to you a little bit more about the detail with our access initiative.
Thank you, Carrie. So one thing that I'd love to note up front is a question that we've heard as we've shared the story of our access journey in the last couple of years. A lot of our peer organizations want to know, what consulting firm did you use to help identify your baseline opportunity and come with your strategic plan? And it was all done in-house. So our goal now is to, now that we've shared what the structure of the initiative looked like, is to share some true nuts and bolts of how did we approach these challenges, what was some of the feedback that we heard from our physicians and administrative partners, and then what were the outcomes that came from it. So as Carrie had shared already, one of the biggest barriers that we noticed in our baseline assessment is that 20% of our appointment slots went unfilled. A lot of times our leaders might have shared that we could see more patients if we had more providers. But the truth is that we have almost 1,000 outpatient providers in our system already. And what we saw when we evaluated their clinical templates was a huge amount of variability in the hours that they were seeing patients every day. So once we started digging into that, and again, we evaluated templates for 944 providers, we saw that some people started their day at 8:30, some people started at 9, some people took a half hour for lunch, some people took an hour. We weren't able to provide patients with reasonable expectations of what clinic hours were across the 45 specialties that we included in this initiative. So what we did was create a standardized 4-hour clinic window. If you are a physician that is expected to be in clinic that day, you are either going to see patients from 8 to 12 or 1 to 5 with some, leniency and variability based on a number of personal or administrative factors. But by completing this evaluation and standardizing templates across the system, we were able to add 53,000 net new appointment slots that didn't exist prior to that assessment. The other thing that's important to note there is that a lot of these appointment slots were either at the beginning of the day or the end of day. So when we think about approaching all of this with a view of customer obsession, that means that we're providing appointment slots when patients really want them. To try to prevent parents from having to take off of work, for our patients to miss school, and see the provider that they want to see. If we were able to maximize all 53,000 of those net new slots, that represents almost an $8.5 million gross patient revenue opportunity. So without adding any additional providers and streamlining processes and clinic windows across the system, that represented a huge amount of opportunity financially as well. So that was what we did in year 1. Year 2, they said, all right, we created all these slots. How are we going to fill them? We knew that the biggest gap was our no-show rate, which across all of our areas was over 10%. And 10% was our goal for the system. So that is really what we were hoping to reach. We know that with the long wait time to schedule an appointment, a lot of times patients are scheduling 6 months out in advance. And who really can say what their schedule is going to be 6 months from now on a Tuesday in the middle of the day? So what we had in place previously were some text message reminders that we wanted to bolster, but we also wanted to enroll more of our patients into our text message reminder system. Previously in Texas Children's, we were an opt-in system. So you had to opt yourself into the text message reminder system. What we decided to do is to transition over into an all-in reminder system. Of course, you always have the opportunity to opt out if you prefer not to receive communication in that way. But we had a mobile number for our patients in the system. As you saw in our baseline assessment, we know that that is how our patients prefer to communicate with us. So we just in that one IS switch enrolled an additional 80,000 patients into our reminder system. We'll get a little bit into the nitty gritty of how we changed that. But what we found over the course of the first year is that we had an opportunity to mitigate 12,000 no-show slots every year. Another thing that we realized was that even though we had text message reminders prior to an appointment, if a patient no-showed for their appointment, unless clinic had bandwidth to be making outbound calls, we oftentimes, didn't have a concise follow-up process with those patients. So what we also did was implement additional message reminder systems the day after a patient failed to arrive for their appointment saying, hi, we missed you yesterday. Respond 1 if you would love to reschedule your appointment now, or 2 if you'd like someone to call you tomorrow. We had 11.5% of our appointments that were not arriving for their appointment, and we were not recapturing them. By going to that all-in system, we enrolled 80,000 additional patients. And prior to Access 2.0 in the second year, we only sent a one-way reminder text message at 3 days before the appointment. But what we know is that a lot of times 3 days is not enough of a heads up to remind them that they had this appointment and be able to shift their lives around to make it to the appointment. So as is standard with a lot of our partner organizations, we added a 7-day reminder as well as a 3-day and a 1-day, one-way reminder to allow patients to confirm that they're going to arrive for their appointment or cancel their appointment. If they cancel their appointment, they also had the opportunity at that point, similar to the no-show re-engagement message. If they cancel their appointment, the next day we would send them a re-engagement message to try to get them to be back on the books again. So what we found is that By adding the 7-day and the 1-day reminder message, over the course of the first year, our no-show rate dropped by 1.5%. And that might seem like a small percentage, but with 1,000 providers and as many appointments as we see across the system, that represented over 1,000 extra appointments every single month that we were able to capture. And with the 5% increase that we had in the no-show rescheduling rate, that was another 400 appointments a month. So while a lot of these strategies were intended to help serve our patients and families, the customer that we think of first, another big customer of ours is all of the referring providers that send patients into the system. And we know that they were frustrated that they had 60 plus referral processes. So if you were one PCP in the Houston area, you might have one form in process to send a patient to neurology and another one to send them to allergy and immunology. By standing up a team to focus specifically on the referral process, we were able to standardize 90% of the content that was in that referral form so that a lot of it people would be much more familiar with. In tracking it with time studies, we know that previously it took 2 minutes to fill out the full form versus now it only takes 30 seconds to fill it out. We went from 40 plus submission routes down to 1. And we also knew that it's important to be able to provide follow-up with the PCP that referred the patient into our specialty care system. And while 60% of our specialties were sending after visit summaries to the referring provider, now all of our specialties are sending them. With customer obsession always front of mind, we wanted to redirect patients towards self-service wherever possible. We know that in the way that we order food on our phones to be dropped off at the door or order things online, that a lot of times we don't want to talk to somebody on the phone. We have a huge number of services that people can do through our patient portal, but we had to make sure that they're activated in there in order to be able to do so. So with a huge rallying cry internally, we trained an enormous number of employees to be able to activate patients into our portal, improved our education and scripting internally in order to do that, and added a number of incentivization mini projects. We had a My Chart Madness in tandem with March Madness basketball tournaments. We had a number of different marketing deliverables. Basically, you could not turn a corner in Texas Children's without seeing, advertisements for our patient portal on the elevator or in a flyer or on a button of the person who is checking you in. We also added a number of patient-focused features to the portal to make it more user-friendly for a very diverse population, including Spanish language options, an electronic wait list to allow you to say, hey, I know that I had this appointment scheduled 6 months out, but if there's an earlier appointment available, I would love to claim it. So if that becomes available to you and you're on the electronic wait list for FastPass, you get a text message reminder when an appointment becomes available. You can claim it through your phone and your later appointment automatically is canceled out. We also added the opportunity to check in for your appointment using pre-check-in. This, as we'll share a little bit later on, has become so important in the face of being able to invite our patients to have a touch-free experience when they arrive on campus in the face of the pandemic. One of the biggest pieces that we had heard from our patients is that they wanted to be able to schedule their appointment online. They didn't like the long wait times calling our central scheduling group, and they wanted to be able to see a range of possible appointment times for them to get in to see a provider. With that, we started off with our online scheduling initiative. And at that time, it was our understanding that we were the first pediatric hospital to offer online scheduling in a mass way for our patients. So they could enter that through a number of different kinds of portal points. And it was really important here in particular to partner with our marketing teams in the organization to make sure that people knew that this option was available for them. So anywhere that you go to engage with Texas Children's online, you would find a button to yield you towards an online scheduling opportunity. So whether you're finding us online, and then another place that people come to us a lot if they don't necessarily know a provider that they're being referred to in particular to look for is through a browser. So what we did was made sure that we claimed all of our rich search results in the different browser platforms to be able to direct patients directly towards numbers for the clinic. So instead of a result getting them to just the Texas Children's website, there could be a button there that says either schedule an appointment now or call the clinic. And so being able to push people directly to a scheduling opportunity really has increased the satisfaction when trying to make an appointment. So with all of those different opportunities to schedule an appointment, In the first year, over 50,000 were scheduled online. And when you think about the huge number of burden that this takes down from our in-person call center in terms of the wait time and time on hold, it's really created a better experience for our patients. And we've been able to move more areas into our central scheduling opportunity. With those rich browser results, we had over 100,000 organic hits that either came to our website, but eventually landed on the schedule an appointment page, again, in the first year. And 13,000 calls have come directly from clicking on those links in the browser-rich search results, which all are just ways that patients are able to utilize self-service, schedule an appointment on their own time, not necessarily being burdened by when the call center was open. And we've actually come up with some plans to be able to expand this much further in the wake of telemedicine ramp up and what scheduling appointment looks like now in a period where we're trying to keep people from coming into clinic all at once, which we'll share with you in a little bit. But first, Carrie's going to share what some of our outcomes were after the first 2 years of our Access initiative.
Thank you, Grace. This slide really demonstrates what we started our presentation with. And so these statistics we're going to share with you are really from fiscal year 17 when we started to fiscal year 19 of the Access improvement. So as we shared, when we started the project, 20% of our appointment slots went unfilled in 2017. And by using many of the elements that Grace shared with you, we've been able to really fill many more of our slots. And as a result of that, we have seen a 27% increase to monthly outpatient visit growth from fiscal year 17 to fiscal year 20. And our organization has never experienced organic growth of that volume, and we do largely attribute that success to the Access initiative. In addition, it was really critical that we take advantage of the no-show rate and try to reduce it so that patients really realized and showed up for those appointments. And so as a result of many of the reminder efforts to improve and enhance our reminders for families, we were able to reduce our no-show rate to 7.7%. That is many thousands of appointments that we will realize as an organization this year through those reminder efforts. In addition, we knew that most patients wanted to be seen within 14 days. And when we started the project, only 66% of our specialties could actually offer that. I'm excited to share that that's now grown to 83% of our subspecialties and specialties can offer an appointment within 2 weeks. We also knew that only 51% of our patients were actually using our patient portal, which was becoming more and more important with new technologies like online scheduling and pre-check. That now has grown to over 72% of patients using that portal. And we have more work to do, but we're really excited about where we've landed. In addition, in our surveys that we take for patient satisfaction, when we started, only 57% of patients said that their ease of scheduling experience was very good. And we are so excited to share that it is now 78%. And I don't know about any of you, but sometimes it can be really difficult to impact those satisfaction rates. And so we're very proud of where we've come. Not that anyone is happy with 78%. We'll keep working at that, but we are very proud of where it is today. And then finally, we were able to streamline down our 60 different referral processes across the system into one referral process. So now all of those referring providers that struggled so much before with sending patients to Texas Children's have one seamless process that is much easier for them to use when sending a patient to us. And across all of this, we did have a lot of revenue opportunity attributed to the increased volume. The revenue indicated here was really for the first year and really only our professional fee revenue. And so it is much higher than this, but this is really largely attributed to the 53,000 appointments annually that we were able to realize. And this continues to grow every single day. So we did have a very robust plan for Access 3.0. That is our current fiscal year that we are in right now. And we had wonderful intentions pre-COVID, as I'm sure many of you had as well. This year, we had a goal that we have sustained over the course of this project that really included patients getting in when they wanted and where they wanted at Texas Children's. To drive that further, we were going to really work on template governance, making sure we were maximizing all possible capacity. We were also really going to focus on electronic health, so leveraging our existing platforms for eHealth, as well as deploying asynchronous and synchronous visits, which momentarily I will share with you did come in handy for COVID. We were also going to evaluate opportunities for provider expansion, so evaluating digital scribes, after hours and weekend visits, as well as space utilization. And then also further refining our digital access. How could we further refine online scheduling, expand it, and then really deploy pre-check-in? But us, like everyone out there, really had to think differently in the light of COVID and what our new focus was going to be in our new healthcare delivery models. So rethinking patient access in the face of COVID, we rapidly deployed telemedicine over the course of a very short period of time. Ensuring care continuity for all of our patients that very much needed us was at the focal point of what we deployed post-COVID. In addition, it became very important that we really offer a touch-free patient experience, because with all of the provisions put in place for COVID, we knew that we needed to understand what could be automated and electronic. In addition, the entirety of our care delivery model today had to become much more innovative and looks entirely different now than it did prior to COVID. So all of this was really critical. All of it was access related, but it did really change our goals for this year with relation to how we were going to think about patient access. So I'm now going to turn it over to Grace, who's going to talk to you a little bit more about these efforts.
We actually found ourselves in what I would consider a fairly fortunate point in March when everything started to change, in that we already had selected a major telemedicine vendor. We were starting to pilot what telemedicine would look like, and had created some patient education systems. So as you'll see in some of these numbers prior to COVID, we were having 10 or 12 weekly telemedicine appointments. There were 16 specialties that had a couple of providers trained to be able to deliver telemedicine and offer it to sometimes very niche patient populations. And we had 173 patients that had had a completed telemedicine appointment with one of our providers. Then March came through, and just like everybody else, we had to really scramble to understand, what does our care delivery look like these days? How can we make sure that we have continuity of care for our patients, but do it in a way that keeps them safe, keeps them at home, and also keeps our providers safe? So we went from doing about 10 telemedicine appointments a week to, in April and March, we were doing 11 or 12,000 telemedicine appointments a week. And because we were able to turn this on so quickly and not have a fragmented process across the system, thanks to a lot of our partnerships with our administrative leaders, our IS leaders, and our innovation team leaders, we know that telemedicine is here to stay. And some of our practices were even able to not only meet their number of budgeted appointments for the months of April, May, and now going through the summer, but have even exceeded their budgeted appointment numbers, because they realized for some of their patient populations, it makes more sense to be at home. They have better ability to see what their treatment needs might be in their environment that they're in all the time. And so this is really going to change the way that we do business forever. We have piloted telemedicine in almost every single specialty that we serve. Almost 1,500 providers have been trained to use our selected platform, and over 42,000 patients have had a completed telemedicine appointment somewhere in the system. Some of them have had many appointments, and the feedback really has been wonderful. But when we do bring our patients in on site, we have to take extreme care to make sure that we're keeping them as safe as possible. Like all other organizations, we instituted very rigorous visitor processes, screenings when you come into the building, and everything that we can do to offer a touch-free patient experience when you come in. From our check-in with, as you see here, the thermal cameras to take your temperature when you come in the door, to having somebody badge you into the elevator so that we aren't worrying about everybody touching things in the elevator. But also, as we mentioned back before with our patient portal, very importantly, to offer our pre-check opportunity. So in that pre-check, you can fill out all of your questionnaires, you can do your travel screenings, you can change where your preferred pharmacy is, and you can pay your copay. And this means that our welcome desk staff are minimizing interactions between the patients and hope to offer that kind of experience that people want when they come into the building. But then once we do take care of our patients, there are some things that may not be completely medically urgent, but we don't want to leave patients without the care that they desire. So one of the more fun things that we've been able to implement in the last few months, it's become less fun as it comes to be June and July in Houston, and the heat rating with humidity is getting up into triple digits, but is our Patient Express program. So In this, what we did was come together with our Chief of Dermatology, Dr. Reagan Hunt, and our administrative leaders over those areas to create a drive-through clinic similar to the ones where we have offered COVID testing for patients to come in and do it in a drive-through environment. But what we're actually doing is drive-through wart removals, which is not something that I would have thought would thrill me a year ago, and has turned out to be one of the most exciting places to receive feedback from our families, where they say, that they feel like we're keeping them safe, but still offering them the care that they want when they want it, which is right now. So now we're going to share with you a little sneak preview of what that Patient Express drive-through experience looks like.
Hi, welcome. I'm Dr. Han. I'm a pediatric dermatologist. All right, nice to meet you all. Gonna feel cold on your skin. Yeah. How you doing? All right, you're so brave. Good. All right, great job. There's one.
All right.
Which one first? This one or this one?
So some of the guiding principles included driving a culture of yes. How could we get to yes for all of the patients that we care for? We were also very focused on the customer. This was really about them. It wasn't about us. How can we really serve the purpose that we're here for every day for our patients? In addition, we had to keep it simple. We have a lot of very unique programs here at our organization, but how could we make it as simple and easy as possible for the patients we serve? We also had to embrace standardization. The way that we did things before with having 60 different processes and many different approaches simply wasn't going to work any longer. We also communicated frequently. We communicated with our faculty, we communicated with our teams here at our organization, we would do global communications, and most importantly, we communicated with our patients. As we began to offer new technologies for them, online scheduling, e-check-in, any of those features, it was critical that we got the word out to not only patients, but also providers so they could share that with their patients. And so it was critical that we had a very robust communication plan to ensure that we achieved that. And then finally, leveraging technology. We had a lot of great ideas, and when we married that together with all the concepts that our partners in information services had, we were able to achieve so very much for patients and families in the eye of improving access. So it was really these guiding principles that helped us achieve such significant results in a very short period of time. With that said, that concludes our presentation today. We really appreciate you joining us, and we're happy to answer any questions you might have about the patient access journey at Texas Children's Hospital. Thank you.